Welcome back to Living in Mexico. I'm Ana Maria Salazar. Thank you so much for joining us. Well, once again, we're talking about, I don't know what we're talking about, influenza. Um, let me just put this into context, and I'll be very short about this. As you know, this week, the World Health Organization sent out a communique stating that a Mexican individual in the state of Mexico died of, well, not died, but had been found with traces of H5N2. And of course, those of us who've been following pandemic crisis around the world, I've been doing this for the last 20 years, no more, for 25 years since I was working in the United States. Of course, you start wondering, what is this all about? That's why I really appreciate Dr. Mauricio Rodiguez Alvarez. Can you put into context what did we find out this week, and how should we understand what this means? Welcome to the show once again, Doctor.
Hi, Ana Maria. Thank you for inviting me again. It's always a pleasure, and try to help to understand what is happening. As you said, what we are seeing, what we saw this week is part of what should happen in terms of the international health regulation, in which the one country finds something special, atypical, new, that could threaten the world, and it has to communicate to the World Health Organization, and they say, okay, we have this, and they give the information to the World Health Organization, the WHO, and WHO is also committed to publish that information in a period of time, no more than 3 days or something like that. They have to publish that information. So they told us on Wednesday that the Mexican government report to them a case of a male, 59 years old, who has several comorbidities and who died in the National Institute of Respiratory Diseases, and was found to have traces of the H5N2 influenza virus, which is from avian origin. Okay, so actually it has to be named avian flu or influenza, avian influenza. So after that, the Mexican government published a statement trying to explain all the things that had happened since they found the patient from the first time. And we can connect this case. I mean, everything made us think that this is an isolated case. Is not bonded, or it has not relation with any outbreak, because there is no outbreaks. There was no other people surrounding the patient who was sick because of a contagious or a contact with the patient. So it's only that patient.
Apparently it's testing people around.
Yeah, they did that. They did that. And actually they did that in animals in the surrounding area where the patient is from. So this, we can say, okay, this is an isolated, this is a low risk situation. It's not easy to disseminate this virus. It was only this person, which, by the way, they don't know how he got the virus in the first place. And this is just what happening in Mexico, and it connects with what we have seen in the United States and in Australia and in other countries with another avian influenza virus, which is the H5N1. This in Mexico was H5N2, and it's different from H1 and H5N1, which is the worst avian virus. So we still trying to figure what's happening in the US with this H5N1, because it changed the picture. But in the meantime, we see this case in Mexico, and of course, we have to be worried and to be cautious regarding the influenza viruses.
Of course, I've been following H5N1 in the United States, and it has, there's just a lot of reporting about cattle and the number of ranches and the number of cattle persons who got sick because they are working with cattle. And then this horrible fact that this avian flu has also infected cats who may be drinking the cattle's milk, and these cats are dying. And so that's what is so worrisome about what happened here in Mexico, is that nobody knows how this person got sick. I mean, we know he had he was a sick man.
I understand.
But we don't know. And it could have been another person he had contact with that
No, but actually they tested the people who had contact with this patient. And don't forget that this patient has a lot of comorbidities, and perhaps that's why he crossed the way with the virus, but we don't know.
Maybe he opened up a door and the virus was just sitting there. But I mean, it just, what worries me is the way the Mexican government reacted. And, you had the Secretary of Health, we hadn't seen him for quite a while at the morning conference, basically questioning this document, this, report that was issued by the World Health Organization. And he focused way too much on, don't worry about eating eggs or don't worry about eating chicken, which
I think that was important, because there is a misinformation and some sort of I would not say panic, but some sort of fear regarding eating chicken and eggs. So it is important for the people to hear from the experts and not from the Ministry of Health, who has low credibility, by the way, and to listen that there is no risk, because they have found, they have searched for the virus in the chicken, in the eggs. And there is no virus there, and that's not the way the virus it's moved from the
animals to the people. Well, but then of course we have in the United States that they took a large sample of milk, and they found residue of the virus, the virus in the United States, and I think it surprised a lot of people. I think
absolutely,
it
scared the CDC. What we are seeing in the United States, it's changing the way we think about influenza virus, because we are expecting this pneumonia and this very apparent respiratory disease, and we are focusing on that, and the virus actually it's infecting the milk production in the cows, and we don't know how is it going there, and it is not make the cows very sick. It's just like a mild disease.
Well, they now apparently last week we're talking about they had to start killing cows because some of them were getting very sick and they were dying, and others just were not recuperating. So there is kind of a concern that this virus is
and perhaps in the United States could be happening something with the cows, like in the chickens with the avian flu. When they have outbreaks, they just kill and clean all the farm, and they have some money as a recovery program.
They have subsidies.
And perhaps with the cows is something like that. In Mexico, we don't have that, and that's one of the reasons that why the producers of egg and chicken they vaccinate the chickens. So
we have a minute left. Just in general thoughts, what what's your takeaway?
Well, yeah. Let's try to resume the the week in 2 minutes. The first is that it's a low risk situation in Mexico. We have a system, the Sentinel system, that is working, perhaps a little late, but it is working. And fortunately, this patient went to the best place to go for this kind of situation in Mexico City.
Right.
And there was no evidence of transmission or propagation of the virus to other people. It is not located any outbreak in the surrounding area. So we could consider this as an isolated event.
Yeah.
But anyway, we have to be aware, because that's how the puzzle is complete. I mean, piece by piece, the puzzle is completed.
Dr. Mauricio Rodiguez, he's been joining us since COVID-19 pandemic crisis started more than 4 years ago.
January 2020, I think.
Yeah, gosh. Well, I hope. I'm not going to even hope. I think what our role is to be informing what's
let's
going on.
talk again if we need it, and
I
hope we don't, but
we'll be talking really soon. Take care. We're going to go to commercial break. I'm Ana Maria Salazar, and you're listening and watching Living in Mexico. Don't go away. I'll be right back.
Listo.